After 20 years of the struggle, you would think that there would have already been legislation in place to create this, to make this center a safety net hospital, since it serves 250,000 people in the community, and we have the neediest people within the county. Plus, we also serve for those car accidents in the main corridor. We're the only hospital between the areas of, say, Alta Bates and Vallejo to serve these car crashes.
So this is a hospital that's 80% Medi-Cal Medicare, so it's government insured payer mix. So 80% of our patients are on government insurance. Government insurance does not pay for the cost of care. Medi-Cal pays for about 60 cents on the dollar. Medicare pays for close to about 90 cents on the dollar. When 80% of your revenue is not paying for the cost of the service, no business can survive. So this is a hospital that requires subsidy.
Doctors Medical Center didn't get that money, that type of money. It's barely got enough for a can of paint. That's not fair. Their people work here just as good. They have good nurses and doctors, and they service the city where people come in, their kids, and they don't have a place anywhere else to go. There's no other place to go. Either we'd have to go to Alta Bates, which I don't know if they're always gonna take us, or we'd have to go to Martinez. And if you're in the surrounding cities, there's at least 15 surrounding cities surrounding Doctors Medical Center.
And this is a social justice issue. There's no question about it. These are poor people. These are elderly people. These are people who are homeless. These are people who have mental health issues. These are people who have English as a second language, who have come to this country and are working hard and contribute to this community.
It's taking some time to assimilate this, because this appears to be a blatant act of discrimination against the poor. It's called institutionalized discrimination. Because people are not at the table, maybe we're not voting, maybe we don't have the money, maybe these being the poorest people within the county are on survival mode, they're not at the table, so they're being left out. As a result, we're planning to shut down the hospital and thus create a medical desert. Because once you shut down the hospital, it's roughly stated that 60% of the medical practitioners that work here will be leaving because they will have no hospital to practice out of. So you create a medical desert. So you have the sickest community within the county that now has to travel elsewhere to receive their services.
I wish we were like Alameda County, that has a dedicated half-cent sales tax just for healthcare that requires a 2/3 vote. And it's passed twice, and it raises $100 million for healthcare in Alameda County. How great that is. Our poll showed we came nowhere near 2/3.
There'll be severe impacts on the population in terms of urgent care, emergency care, but not just direct effects on caring for people, but also say there's a disaster. That's also an industrial area with lots of refineries. Where are you going to get people to? Do you have to travel 10, 15 miles to go to the nearest hospital? So there are also these indirect impacts that we don't see right away, but might happen in the future.
Even the patients that I'm seeing for nutrition and diabetes are saying, where am I going to go get my mammogram? Where am I going to go get this? Where will I go? And a physician can refer you to other places. Well, I don't want to go to Alta Bates. I don't want to go that far. My concern is what happens when this place closes, support services close, physician offices have to close. Now we start getting into a medical desert. And yes, there will be, luckily, some facilities around to help, like the county, the clinic down the street, the urgent care. So those are some benefits, but we're also going to be at a loss for a lot of other services.
We have to be part of a bigger system where the losses associated with this hospital are absorbed in a larger system. Unfortunately, even under Obamacare and the Affordable Care Act, because only 10% of our patients are uninsured, the impact of expanding access and expanding government insurance to residents that previously had none actually did not help this particular hospital.
When you look at the news now, you're seeing 6 hospitals in the Bay Area that are closing down. Famous ones like Seton Medical Center over there in Daly City. O'Connor, where if it wasn't for O'Connor Hospital in 1966, I was brought there as a little 7 or 8-year-old, and I had no hearing in my left ear. And they went in there, cut the ear off, and made new hearing drum and the little bones and put it back together again. That's a community hospital. How can you have a community hospital in a community closed down? I just never heard of anything like this. And you know, when you go out and talk to people that's in the hospital, as I did yesterday, I talked to 4 or 5 people and I'm asking them, you know, how long have you worked here? 35 years, 40 years. And tell me a little bit more. He said, well, you know, the funny thing is my whole family was born here. You know, the husband, the wife, the kids, everybody was born here. And this is a true community hospital that's closing down. It's just unbelievable.
When did caring for a community and their health and having a hospital in walking distance or driving distance for West County become a business and less about helping people? That's what's been frustrating me about this entire time. Just recently, my mother had to go to the hospital, and then she gets a letter saying it's going to close, and she said, how many people are going to die from this hospital being closed? And I think people are numb to hearing this word. People have died, and people are going to die.
We just lost somebody yesterday from an example, and we haven't heard very many, but someone got hit by a car, and they were here about 2 or 3 blocks away. Well, the ambulance couldn't bring them here because there's no ambulance service right now. So they had to take him to John Muir. Well, on the way, he died.
What's clear is the lack of emergency services in West County is tragic. There were only 40 emergency room beds in all of West County between Kaiser and Doctors Medical Center, serving a population of 250,000 people. Doctors Medical Center was 25 of those 40 beds. So now the population of West Contra Costa County is being serviced by 15 emergency room beds.
My husband, Frank, he was here, seeing from the doctor. And now, where can we go? He got to go to the doctor. He don't have no car. At least over here, he can take a bus. Where did he go now? There's a few minutes in. They're close.
What the heck? Like, it's just ridiculous. And I'm a person that has the wherewithal, that has I consider myself privileged. So I may lose a job, but I'm a nurse. It's easy to employ a nurse that has experience in trauma, ICU, and ER. What is not easy is to find emergency medical attention should something happen if this hospital closes.